What does SARS stand for?
How does someone know that they have SARS? SARS initially manifests as a flu-like syndrome. It can progress to pneumonia, respiratory failure, and death in some cases. Mortality with SARS is much higher than that of influenza, and SARS has two typical stages. Stage 1 of SARS is the flu-like stage, which begins 2 to 7 days after incubation. It's characterized by fever, fatigue, headaches, chills, myalgias, malaise, anorexia, and diarrhea. Stage 1 lasts 3 to 7 days and represents increasing viral load. Stage 2 is a lower respiratory tract phase that begins at least 3 days after incubation. The symptoms of Stage 2 include dry cough, shortness of breath, and progressive hypoxemia. 7 days can pass before any chest radiography findings become abnormal. Respiratory failure that requires mechanical ventilation may also occur within Stage 2. Some minor uncommon features include sputum production, sore throat, inflammation of the mucous membrane in the nose, nausea and vomiting, dizziness, and diarrhea. When patients are physically examined with SARS, their symptoms are consistent with those of a combined respiratory tract infection and the flu. Patients can deteriorate very quickly. Chest auscultation results are often unremarkable, and research on patients with SARS has found that the estimated mean incubation period is around 4.6 days. This is followed by the development of symptoms and hospitalization in about 2 to 8 days. In the early phase of the SARS outbreak, the SARS coronavirus was identified as the cause on the basis of its association with human clinical cases and with the reproduction of pulmonary lesions in experimentally challenged cynomolgus macaque monkeys. A history of occupational exposure to live caged animals that were used as exotic game food, which is a culinary delicacy in southern China, was found in some patients in Guangdong province, in which SARS developed in November and December 2002. SARS coronavirus-like viruses have also been isolated from Himalayan palm civets in a live animal market in Guangdong province, and also in Chinese ferret badgers. The care and slaughter of wildlife for human consumption in southern China is associated with serologic evidence of infection.
What are some of the symptoms of SARS?
Dizziness, diarrhea, rash.
I don't know, probably cough, hacking, just not fun, disgusting, serious cold thing. Yeah.
Headaches, nausea, fatigue, muscle cramps.
Major features of SARS include fever, chills, myalgia, dry cough, headache, malaise, and shortness of breath. Which lab tests are used to confirm SARS? The real-time RT-PCR assay, a serologic antibody assay, isolation and cell culture, electron microscopy for CoV-like particles, or the immunohistological hybridization study on tissue specimen. The most effective way, however, to detect a SARS infection would be through the RT-PCR assay or the antibody assay. The diagnosis of SARS disease and the implementation of control measures should be based on the risk of exposure. In the absence of person-to-person transmission of SARS, the diagnosis of SARS disease should be considered only in patients who require hospitalization for radiographically confirmed pneumonia and who have had a history that raises a suspicion of SARS disease. The suspicion of SARS disease is raised if, within 10 days of symptom onset, the patient has had a recent travel history to mainland China, Hong Kong, or Taiwan, or has had close contact with ill persons with a recent travel history to such areas. A person who is employed in an occupation at particular risk for SARS exposure, including a healthcare worker with direct patient contact, or a worker in a laboratory that contains live SARS, or is a part of a cluster of cases of atypical pneumonia without an alternative diagnosis.
How is SARS treated?
Through medicine.
How is SARS treated?
Probably with like prednisone and some, maybe an inhaler of some sort.
I have no idea. Probably antibiotics.
When were you vaccinated for SARS?
That's not required for pharmacy school, so never. I'm sorry, but that is so true. I'm not getting a shot.
I don't know. Probably either when I was a kid or a few months ago. So I have all my vaccinations.
Currently, there are no specific treatments for SARS. The CDC recommends that patients should be treated in the same way that any serious community-acquired atypical pneumonia is treated. SARS is being tested against various antivirals to see if there's a treatment that could work. In the 2003 outbreak, ribavirin and corticosteroids were extensively used. However, ribavirin was criticized for its lack of efficacy, and corticosteroids encourage viral replication despite effectively lowering the fever and reversing the changes in the chest radiograph. There are many other treatments that can be used for SARS patients besides ribavirin and corticosteroids. Patients with respiratory failure can be treated with non-invasive positive pressure ventilation. Future anti-SARS therapies will include interferons, and traditional Chinese medicine holds promise in treating the infection.
How do you think that SARS is transmitted?
By contact.
What
Skin-
kind of contact?
Skin contact. I don't know.
With like other people?
Yeah, like rubbing.
So SARS most likely is transmitted through like airborne pathogens, I'm gonna say, like the disease. It gets pulled up in like seeds, and then insects will grab onto those seeds and they'll fly them to other continents.
Transmission of SARS is primarily from person-to-person contact and is transmitted most readily through respiratory droplets. It appears to occur mainly during the second week of illness, which corresponds to the peak of virus excretion in respiratory secretions and in stool, and when patients with severe cases start to deteriorate quickly.
How far do you think that respiratory droplets can spread from an infected person?
Just a couple seconds.
That's a time. Distance.
Oh, I thought you said how long. 5 foot.
10 feet.
Droplet spread can happen when droplets from the cough or sneeze of an infected person are propelled a short distance, such as 3 feet, through the air and are deposited on the mucous membranes of the mouth, nose, or eyes of persons who are nearby. Most cases of human-to-human transmission occurred in the healthcare setting, in the absence of adequate infection control precautions. Implementation of appropriate infection control practices brought the global outbreak to an end. The virus also can be spread when a person touches a surface or object contaminated with infectious droplets and then touches his or her mouth, nose, or eyes. In addition, it is possible that the SARS virus might spread more broadly through the air or by other ways that are not now known. Transmission through sewage, feces, food, water, and air are other possibilities that could have contributed to the spread of SARS. It was recently concluded that inadequate plumbing likely played a role in the spread of SARS in Hong Kong during early 2003, so the fecal droplet route is considered another mode of transmission. One of the main risk factors for SARS is the geographical location. The disease originated in Asia and then spread to other continents. Living in a dense population also was a main contributing factor to whether a person was at risk. Disease tends to spread more quickly in dense populations. Personal hygiene is also a large factor. Frequent hand washing can prevent the spread of the virus, and many residents in dense populations began wearing masks so droplets would not be able to enter through their nose or mouth.
How do you prevent SARS?
Gosh, I would just say avoid people.
How do you prevent SARS?
Cover your mouth when you cough. I really don't know. I don't know. You can, probably not cough or sneeze or touch someone who's infected. Just be an antisocial person.
So you would never sneeze.
Yeah, my roommate does it all the time.
I would wear a mask.
If there's another outbreak, some preventative measures include washing hands with soap and water frequently, as well as alcohol-based hand sanitizer, avoiding contact with eyes, nose, and mouth with unclean hands, wearing a mask, and encouraging anyone with a sneeze or cough to cover their nose or mouth with a tissue.